As the world grapples with a steady stream of viral and bacterial infections, ranging from COVID-19 and RSV to norovirus and the flu, the challenge of fighting these ailments grows more complex. While many diseases can be treated with medications, the growing resistance of bacteria, fungi, and other pathogens to conventional treatments is creating a serious public health dilemma. This is a pressing concern that could severely limit the effectiveness of antibiotics, leaving us vulnerable to infections that may no longer be treatable with the tools currently at our disposal. Yet, amidst this darkening picture, a recent study from 2025 has presented an unexpected ray of hope: oyster blood. The groundbreaking research published in PLOS One revealed that the blood of Sydney rock oysters, a type of mollusk, contains powerful antimicrobial proteins capable of neutralizing specific bacteria, including some that are becoming increasingly resistant to traditional antibiotics. The study, led by experts in microbiology, discovered that these proteins could enhance the effectiveness of conventional antibiotics by up to 32 times. This is an encouraging development in the ongoing struggle against drug-resistant superbugs, pathogens that have evolved mechanisms to withstand the very antibiotics that were once our most reliable defense. Oyster blood, or hemolymph, contains a range of unique proteins that function as part of the oyster's innate immune system. Unlike humans, who rely on adaptive immunity, the kind that develops over time in response to exposure to pathogens, oysters must survive in environments teeming with harmful bacteria, viruses, and parasites, without the benefit of antibodies. As a result, oysters have developed robust immune defenses, which include these antimicrobial proteins that work in multiple ways to neutralize potential threats. The oyster's immune system is not only resilient but also efficient, designed to protect the creature in its challenging and often hostile coastal habitat. The specific proteins that were identified in the study were found to combat bacteria through mechanisms that differ from conventional antibiotics. The most promising of these is a protein known as cystatin B-like protein, which acts by inhibiting essential bacterial enzymes or by directly disrupting the bacterial cell membranes, essentially puncturing the bacteria's defenses. This ability to attack bacteria through distinct pathways gives oyster proteins a potential advantage over traditional antibiotics, which bacteria have become increasingly adept at neutralizing. What makes the discovery even more exciting is the way in which these proteins complement traditional antibiotics. When oyster proteins were combined with standard antibiotic treatments, the effectiveness of the antibiotics increased substantially, making them up to 32 times more effective against resistant bacteria like Pseudomonas aeruginosa and Klebsiella pneumoniae. These bacteria are notoriously difficult to treat with existing medications, and they have been responsible for a significant number of healthcare-associated infections. By enhancing the potency of antibiotics, oyster proteins could provide a powerful tool in the fight against these increasingly resistant pathogens. Another major benefit of oyster blood proteins is their ability to penetrate bacterial biofilms. Bacteria, particularly those that form biofilms, a protective slime layer that shields them from antibiotics and the immune system, are some of the hardest to treat. The research showed that oyster proteins could break through these biofilms, allowing antibiotics to reach the bacteria more effectively. This feature is particularly important in treating chronic infections, which often involve bacteria encased in biofilms, such as those found in respiratory infections and certain skin conditions. While the concept of using oyster proteins in human medicine is still in the early stages of development, the potential applications are vast. Researchers are exploring ways to incorporate these proteins into pharmaceutical treatments. For example, oyster proteins could one day be used in inhalation therapies for respiratory infections or injected alongside antibiotics for more effective treatment. They could even be formulated as topical treatments for skin infections or wounds. The possibilities are exciting, and the promise of this natural solution to a growing global problem cannot be overstated. However, while the findings are promising, it is important to acknowledge that this research is still in its early phases. Much more work needs to be done to develop these proteins into viable therapeutic products. Clinical trials, further safety testing, and additional research will be required to ensure that these treatments are both effective and safe for human use. It may take years before any oyster-derived products are available to the public. But even at this early stage, The discovery offers a glimpse into an entirely new approach to treating drug-resistant infections. What is particularly compelling about this research is the shift in how we are approaching the problem of antibiotic resistance. Rather than continuing to try to develop new antibiotics, an endeavor that is quickly becoming less effective as bacteria evolve resistance, we are now looking to nature for solutions. The idea of using oyster proteins to combat superbugs is an innovative strategy, one that draws on the wisdom of evolution and nature's ability to find solutions to complex problems. This approach could lead to entirely new classes of antimicrobial treatments, which bacteria will likely struggle to resist in the same way they have with traditional antibiotics. Antibiotic resistance is a growing crisis that demands urgent action. The global health community has been sounding alarms about the dangers of overuse and misuse of antibiotics, which accelerates the development of resistant bacteria. However, with research like this, we now have a potential pathway forward, one that could open up entirely new methods of treatment and slow the spread of resistant infections. By harnessing the antimicrobial properties of natural substances like oyster blood, we could take a giant step forward in preserving the efficacy of our existing antibiotics, while also developing novel therapies that bacteria cannot easily adapt to. In conclusion, while the battle against drug-resistant superbugs is far from over, the discovery of antimicrobial proteins in oyster blood represents a promising breakthrough. This research not only highlights the incredible potential of marine organisms in medicine, but also underscores the importance of exploring alternative solutions to the growing challenge of antibiotic resistance. As scientists continue to investigate and develop this novel treatment, the hope is that oyster blood could become a vital weapon in our ongoing fight against superbugs, offering a new tool to protect human health and preserve the effectiveness of antibiotics for generations to come.